Okay, well, thank you everyone for tuning in and welcome to CTO Talk. I am your host, Matt Ferrari. On this 30-minute program, we're going to discuss issues, challenges, and opportunities that are impacting healthcare tech out there today. You can follow the show at hashtag CTO Talk. With me, I'm lucky enough to have Adam Klass, CTO of Vigilanz. Today, we're going to talk about clinical surveillance, and I'm really excited to really talk on this topic. It's a new topic for us here at CTO Talk. Welcome to the show, Adam.
Thanks for having me.
Absolutely. Would you mind telling us a little bit about Vigilanz?
Sure. So Vigilanz is really a company that's focused on helping clinicians help patients. So what we've designed is a platform where basically we try to take any sort of manual data collection processes that clinicians are having to do to help their patient populations. We try to automate that as much as possible. So we listen for real-time data from the electronic medical record, all the real key pertinent clinical data that the clinicians would need to make a decision. We have a process that highly curates that data and gets it into a format where you can start to ask interesting questions of that data. And then we have rules engines that are running, that are tracking all the different types of clinical scenarios that our clinicians are looking to track. So it really allows them to focus on the patients that need their attention the soonest.
That's great. So this is my fifth HIMSS, and for the audience out there, we're at HIMSS today, so you guys may hear some background noise of activity. And every year, Adam, that I've been so far, data outcomes are such a big topic, and what clinicians actually can do with data. Tons of conversation that I have, and even in my own business, around the tremendous amount of data that's out there. I'd love to understand, how, as you just mentioned, kind of that prioritization of patients. How does Vigilanz approach all of the data that's out there, and how can you help a clinician actually take action?
Yeah, so what Vigilanz does really well is really takes that information that's within the electronic medical record, which is extremely valuable information, of course. It's what's happening to the patient at that moment in time, is able to present it with technology in a way that really allows you to focus on the specific patient situation. So if you're in a hospital, it's a 1,000-bed hospital, and the average patient's on 20 to 30 medications, and they're getting lab test results, and they're having surgeries. It's very difficult as a human to put all that information together and figure out who to see first. What we've done really well is figured out a process of really curating that data and then putting intelligent rules on top of that data to really be able to display specifically the actionable items that they need to go tackle. So it's a really big time saver for the clinicians that are working with patients. And it's really saved lives. We have great catches that we're getting on a weekly basis that we hear from our clinicians around the country, where really something that popped up in Vigilanz really alerted them to a condition where they were able to stop a medication or be able to track an outbreak that's happening within a certain floor or location within the hospital based off of using technology. So it's really a nice place to be, and using technology for a really good cause. So.
No, that's great. I have the opportunity to talk to lots of providers and clinicians on a fairly regular basis, and a lot of the challenges that they face are perception. So you just mentioned EHRs. A lot of clinicians find them difficult, right? Change is difficult. So you just spoke to outcomes really well. How do we best educate either at Vigilanz or even here at HIMSS? How do we best educate a clinician that there are better outcomes as you kind of mine data through EHR rather than just all of the the forms and charts and EHR integration problems that exist?
Right. So there's been so much time and effort and money put into getting this information into the EHR, but really the value is in that is really looking at that data and actually truly seeing what the outcomes are. So if you're not doing anything with that data and it's just collecting, you're not affecting patient care, you're just adding hours to the clinician's time, you're really in a tough spot. So I think that's really where Vigilanz focuses. We're very niche. We're very focused on some really specific clinical practice areas, and we're trying to make a difference with those clinical groups in the hospital and showing them how valuable this data really is, whether it's discrete data or non-discrete data. Being able to roll this information up into a data warehouse so they can really look at outcomes across their individual hospital or across their system. So there's some real value in that data. So it's how do you get access to the data, and what are you going to do with that data in order to help patients?
Yeah, absolutely. And I'm certainly curious, what EHRs or EMRs does Vigilanz, talk to today and play with today?
So we're agnostic. Yeah. We work with all of them. So we've got probably over 100 hospitals that are running Epic, and dozens on Cerner and Meditech and McKesson. Some of our hospitals have proprietary systems. So we're pretty good at sort of working with them on what they currently have available and getting that into our system so we can start to run our processes against it.
That's great. I talk to a lot of folks that tend to focus on one EHR, but the challenge, as I'm sure you run into often, is interoperability, right?
Mm-hmm.
So I'd love to know from you, how can EMRs and third-party vendors, work together to solve kind of those interoperability challenges out there?
Yeah. So we have systems that have multiple EMRs within the same system.
Yeah.
But they want to have standardized rule sets across all of their hospitals. So we really needed to come up with a platform that allowed for an Allscripts and a Meditech and a Cerner and an Epic all to be within the same system, but have the same rule sets running against that data. So we've designed a data normalization process that's able to take that information off the wire and get it into the same format, independent of what the EHR is for that particular hospital. So
yeah, I would assume that is such a great value prop for you guys, just because of if nothing else, the amazing amount of consolidation in the provider space, right?
Absolutely.
It's overwhelming.
Yeah, we have some pretty large systems, and they're not necessarily going to convert all of their hospitals that they're acquiring over to a single EMR.
Yes, absolutely.
It's a tremendous cost to that. So.
Yes, absolutely. I see that often, even in the cloud space that I'm in, right? Certainly, lots of providers would love to go to a single cloud product or a single EHR vendor, but the truth is it's never the top priority, right?
That's right.
Even from a cost perspective, a staffing perspective, an expertise perspective. I was actually at a provider in Dallas, a large hospital chain in Dallas, maybe 3-4 weeks ago, and their challenge, Adam, was they have such legacy expertise on their own IT team about all of the customization they've done with their EHR, that now that they've been acquired by a larger entity, the larger entity says, just leave that alone, let it run. So I assume that's a big place you guys can help.
Absolutely. So that larger corporation we can take that legacy data and take some of the use cases that they want to be tracking at that corporate level and have it applied to their current organizations as well as what they're running in their legacy.
Yeah,
so,
that's very helpful. Certainly, to take a step back for a moment, I'd love, as you guys were sitting down, we were talking about kind of your legacy and your history at Vigilanz. I'd love the audience to learn. A lot of the folks here in the audience are, in the healthcare startup community. So would you mind telling me kind of the history of the organization?
Sure. So actually, I do not have a technical background. I political science major. And I was getting a public administration master's and trying to figure out what I was going to sort of do with my life a little bit. I really got into statistics, and I was doing an internship at my father's hospital. He was running a large state mental hospital in Illinois, and we were doing a study on patient falls, and I was really getting into that. And he was starting to look at data because the Justice Department had come into his hospital and said, you need to reduce the number of medications your patients are on. And he had, about 700 patients in the hospital, and they're all on a lot of medications. And he's saying, well, how am I going to do that? And he started to pull information from a mainframe in Springfield, Illinois, and started to look at this data. It was sort of the beginnings of sort of taking large amounts of information and curating it and getting it into a format where you can start to ask those interesting questions. And I saw that he was doing that. I said, I can do that with a computer? What's the data?
Sure.
Databases and all this stuff. And I was just totally hooked. And that was probably in the fall of 1994. We started working together, and we did a project for all the state mental hospitals, really looking at, as patients are put on medications, are the physicians following the proper best practices? Are they ordering labs within the proper period of time? And we had an application that ran once a month. We'd push a big button, and it would crunch for hours and hours and hours. And then at the end, these reports would pop out. So we kind of felt like we were onto something as far as taking information that's already available and really starting to make it useful in a clinical setting. So we spent some years trying to sort of start a company, which neither of us really knew how to start a business. So that was a little challenging. We ended up connecting with Dr. David Goldstein, who's one of our founders and chairman and CEO of Vigilanz, an ER physician, and really understood what we were trying to accomplish. So we ended up forming Vigilanz in 2001.
Wow.
And that's sort of how the company got started, but it sort of fell into it. It's been an interesting journey.
Yeah, so thank you. I appreciate you sharing. I saw that, so you guys have been around a long time, but I saw that as recently as a couple years ago, you guys were named Gartner's, cool healthcare provider. Yeah. And I have a history both at my current company and previous companies of going through, Gartner Magic Quadrants and various Gartner reports. So since 2001 and even going back into the 90s, why does Gartner think you guys are still cool, right? I mean, normally they give that to new companies. How have you guys continued to keep up with that?
Well, I think we've sort of picked a really specific area that I think there's maybe a handful of companies that are truly laser focused on it. And really, we want to work with real-time data. We want to run rules engines against that data and be able to track any clinical use case in an intelligent way. And that's really all we focused on. We're not an EHR. We're not trying to chew off too much. We're really sort of focused in this area. Frankly, I don't know if there's a lot of other companies that are as laser focused as we are. And I'm not sure why they saw it as a new or innovative piece. Maybe us being part of Gartner was maybe a little bit different than some of the other companies that they generally look at. And maybe a lot of people don't know that there's companies like Vigilanz that are out there that are sort of really focused in this specific area of helping clinicians help patients. So
yeah, I mentioned in my opening, Adam, that this is kind of a new topic for me. Certainly, I've done my own research on it, but I happen to think you're right. I think this is probably an underserved and part of healthcare. I truly believe that. I'd love to dig in a little bit to the tech. So you actually just mentioned rules engine. So would you mind kind of talking about your advanced rules engine and alerting and how ultimately that helps change, outcomes for patients?
Yeah, absolutely. So there's two core rules engines that we've designed at Vigilanz. We really started in the clinical pharmacy space. So there's a term called adverse drug events. So patients that they get the right med, it's supposed to work for them. It's not that they're allergic to it, but it's just not working correctly for them. And you can measure whether the drug is working by looking at the patient's physiology. So one of the first rules engines we came up with really being able to track any drug in your formulary and relate it to any lab test result. So if that relationship exists, the clinical pharmacist can start to track whether things are abnormally high or low. And then patients get dosed very specifically based off of whether they're adult or a kid or what their weight is. So we have all of these. Basically, we have a rules engine that basically takes what a clinical pharmacist does and thinks about and has to manually pull that information around and does all that automatically and presents that to them and only alerts them when they're not following their own guidance. So the hospitals builds their own guidance into these rules. So it's not Vigilanz saying, here's what you should be tracking. They're saying, using our point and click rule builder, here's what we do at our hospital. So that's the first rules engine that we designed, very drug lab specific, very pharmacy specific.
Sure.
In that case. But the second rules engine that we designed was much more of an abstract type of a rules engine, saying that really any piece of data that comes into our platform, you should be able to trigger off of that, or that should be the guidance, or that should be a filter within a rule, all with a time component associated with it. So if you think about any clinical use case you put to paper, you're going to, if this happens, I want to see this happen within a period of time. And that's really sort of the scenario. So we have a rules engine that basically can track any clinical use case within the hospital. So if you're trying to track, sepsis or DVT, you're trying to track infections, things for quality of care. So we have thousands of rules that our hospitals are running that are tracking all these different scenarios and then providing workflow and then outcomes and analytics around that.
It's really interesting. Actually, you just mentioned something that's near and dear to my heart. I have the opportunity to work with a large academic provider that is actually trying to use machine learning to track, diagnose, and prevent cases of sepsis in their facilities. Right. So it's great that you guys are trying to approach that as well.
And we've actually, so as part of our services now, we actually have a predictive service as well. So as this information is coming off the wire, for example, around sepsis, we're able to pass that into a machine learning model that we actually run for that specific hospital with their patient population to train the model. And then we're able to score that patient with a very high positive predictive value, really 12 hours prior to that sepsis diagnosis coming in.
Wow.
So having some good success with that as well.
That is very helpful. I'm certainly curious, as you think about the type of persona or individuals that are important to work with the Vigilanz system. You mentioned kind of taking the hospital's best practices and building them into the rules engine.
Mm-hmm.
Who do you typically work with in that regard? Who is that important to?
It depends on the clinical user group. So there's the pharmacy group, so they're focused on best practices for pharmacy. We have an antimicrobial stewardship services, so really taking what they're running for their antimicrobial stewardship program, getting that down to a rule set. So they're being alerted in real time to those things. We have an infection prevention service, so the infection preventionists that are going on their rounds and they're trying to figure out who needs to be isolated, who needs to be reported on, is there a suspected healthcare associated infection. So we've got that user group with rules running. And then we also have a lot of quality users in our system that are trying to track things like sepsis and DVT, and they're doing opioid stewardship. What's really nice about the platform that we provide is as they come up with another use case that they want to track, like we have a hospital that's looking to track acute kidney injury, we can stand up what's called a discrete service for them. So we can take a very customized rule set to look for that particular patient population and have that run in real time. We provide workflow and analytics and reports. So as they come up with more ideas, that just sort of flows into our rules engine for them.
Excellent. Thank you. And so if you're just tuning in, this is Matt Ferrari of CTO Talk. You're talking to myself and Adam, CTO of Vigilanz. Look, we're talking about what you should know about clinical surveillance, but to be honest, what we're really talking about is improving patient care. I mean, that's truly what we're talking about today, everybody. So as you think about, you mentioned kind of machine learning, and that's a hot topic for me every day, both because I work in compliance and public cloud. I'd love to know, what are your thoughts around some of the AI, machine learning, predictive analytics solutions you're seeing out there in the market, and how do you believe that's going to change healthcare?
Well, if you can see what's coming around the corner with a pretty high positive predictive value, it's a game changer, especially if you're thinking about things like sepsis. I think we're still in our infancy on this. I also think that just looking at how long it took Vigilanz to sort of get the word out about doing clinical decision support and tracking adverse drug events, and how many years it took hospitals to embrace the idea of having a rules engine run and display what they should be looking at. I think it's going to take some time for people to really feel comfortable with a number coming out and saying that, this is what you should be doing. So I think we're going in the right direction. I think we're seeing more and more hospitals are more and more interested in what we're doing on the predictive side, but I think it's going to be a slower journey. But it's unbelievably powerful.
Yeah, I agree. I came from a non-healthcare specific industry 5 years ago. And so there's moments, Adam, where I find myself a bit frustrated that it takes so long to adopt new technologies.
Healthcare moves a little slower than the business world.
And a lot of it is around getting folks comfortable with change. Right?
Absolutely.
I was talking to someone yesterday around growing up. So my own father was a neuropsychologist, studied brain injuries, studied progression in Alzheimer's and various other challenges of the brain. And he grew up focusing on best practices that come out of physician journals and not what is spit out of a EHR machine learning platform. That would blow his mind.
Yes.
So I think change is going to be hard.
Absolutely. Yeah.
Thinking about the interoperability play, I'd love to talk about that.
Sure.
What shift or what role does interoperability play kind of in value-based care? We've seen stats where it's top of mind for most CIOs. What do you actually see in your business?
So with all the things that Vigilanz can do, you can also data starve a system like Vigilanz, right? So
absolutely.
So we have hospitals that are sending us all the clinical data that we'd ever want, just because that allows us to track all of these different scenarios. We have some hospitals that are only sending us a little bit of data, so they're able to do some use cases in Vigilanz, but they could do so much more. So the real challenge is how do you get a full data set of clinical information over to a company like a Vigilanz that can do some real valuable things with that data for the clinicians to help their patients. So we've been doing a lot of work in that area, really working with a middleware partner.
Okay.
That is basically what they've done is they've given us the opportunity to literally plug into the EMR and use web APIs to actually pull the information we need. So instead of traditionally listening for HL7 and flat files, working with the hospital IT group, which is generally overworked and has a lot of projects on their plate, and having to wait for that build out on their side, we've come up with a process that literally plugs into the EMR using the EMR's own technology.
Okay.
And then what we're able to do is actually wake up every few minutes and request all the information that we need and pull that off of the wire, and then get a full data set into Vigilanz to do all the things that we do from a decision support and analytics perspective. So it's extremely critical for us because if we don't have the data, then we can't provide the services that we provide.
Bit of a sidebar question. Do you have prospects or customers that use Vigilanz and talk to you about the ability of sharing data, of whether it's sharing insights or helping anonymize or de-identify the data to drive insights across providers?
Absolutely, yeah, and we do a lot as well on hospitals have their own data warehouses.
Sure.
There's some really valuable insight that's within the Vigilanz platform. There's clinicians that are working things up and logging their healthcare associated infections and such. So we have processes that actually take that information and send that back to the provider as well if they need that information.
For what it's worth, as offline, I'd love to talk about that more. Candidly, I get to work with a lot of providers that are trying to solve that problem specifically. They only have data, let's say, from their demographic or their kind of economic situation, and candidly, they don't have enough data insights into different challenges that some of their patients face.
Yeah, absolutely.
So I would honestly love to learn more about that.
Okay.
Thinking about one of the use cases that I read for Vigilanz coming in, TriCity Medical Center. Why was TriCity Medical Center set on using APIs to connect Vigilanz versus kind of that traditional HL7 integration that we hear about every single day?
Similar to what we were talking about as far as just resources available, were the interfaces available? Did they have people to actually build the interfaces? What were the costs associated with those interfaces if they didn't exist? So there's a cost on that. There's a maintenance fee. They were looking at probably about 200 hours of IT time in order to do the traditional implementation. So with using Vigilanz Connect, what they're able to do is there's no HL7 coming over to us, no flat files. We're using existing Cerner technology in order to go over the wire and pull the information that we need. So they didn't have to, basically they just needed to run an installation, at their hospital and get the connectivity set up for us, and we were able to pull everything that we needed. So it dramatically, it basically reduced those IT hours down to a handful of hours.
Wow.
And then we're able to get a full data footprint. So with TriCity, there's all kinds of interesting projects that we're doing outside of our traditional services because we have all this information that we can be tracking for them. We're starting to do things with them around sepsis and predicting sepsis. We're also able to write back to the EMR, which is something that comes up a lot with clinical decision support like Vigilanz. Is we have some really nice ways of documenting information, but really they want to get that back over to the EHR. So actually today, went live at TriCity, is the pharmacist, as they write up their work in Vigilanz, they can click a box and actually have it create a document to go back over to Cerner so they're not having to double document.
Interesting. And that kind of leads me into a bit of a interesting question that I've been thinking about for a while. We've talked a lot about solutions today. We haven't talked yet about challenges. As you think about, the biggest challenges out there in regards to accessing patient data within the hospital setting, what challenges or roadblocks do you see hospitals run into?
Well, I think I think there's been some movement in this direction, but I think the EHRs just have to be much more open with the sharing of that information. And I think we're getting in the right direction. I think this middleware that we have available now with some of the major EMRs is starting to open up those doors. But that data does need to be shared. And,
Sure.
and there's a lot of value that's in there. And I wouldn't necessarily call it data blocking.
Yeah.
But I do see some of the EHRs discouraging sort of the use of some of these newer technologies. And I certainly see both sides of that. There's certainly, you want to do this in a careful way with technologies that are tried and true, but we do need to all kind of work together. The whole purpose is to be helping patients, and the more information that these different vendors have for the areas that they're focused on, I think the better off the patient's going to be. So.
No, I agree. I've been meeting with EHR vendors for years now, and some of them I even partner with. But the truth is, the the clause they have wrapped around the data, it can be a bit alarming. I even had the opportunity to present at AWS reInvent a couple of months ago, just as Amazon was announcing, some of their early plans to get into healthcare data and machine learning, and it was a bit troubling to me that the response in the community was not data sharing, but instead of data kind of sovereignty inside of their own organizations.
That's right. And the hospitals own the data.
Yeah.
And they should be able to do with it what they please.
No,
so,
I agree. I know we're running out of time. I'd love to ask one more question, if I may. Tell me about the future of Vigilanz. What do you see coming down the road, either on the technology side or the future for the company?
Yeah, so I think a few different areas that we're really focused on. One is this Vigilanz Connect piece, and really all of our future implementations, and even circling back to many of our hospitals on more data acquisition and trying to reduce the hospital IT hours there. I see writing back to the EMR and getting back into the workflow. And I also see Vigilanz being much more a part of the EHR, so actually plugging in our web portal, so it's really sort of a seamless experience. So the clinician can be within the EHR, they can be doing their Vigilanz workflow, they can be going in between, whether it's PowerChart or whatever it may be, and not having to go between applications as much, so just making a better user experience. And then we're also doing quite a bit on the analytics side as well. So we're doing a lot around outcomes and really tying costs to those outcomes. So we're doing a lot with MicroStrategy and some of the really good dashboarding tools out there to visualize all of this data that we have, more on the analytics side. So that's a really key piece of what we're doing as well. And then getting a little bit more mobile as well, and making sure that when things are alerting on patients, that it's getting to the proper team. So we're doing some things with what we call intelligent routing as well. So just really embedding what we do a little bit more within the workflow of the organization.
That's great. I'm frustrated myself. They're out of time, but I will tell you, you just said something really impactful. I've thought a lot about predictive analytics being applied in a practical way, and you just said the word cost. Almost every healthcare provider, clinician, even CMIO talks to me about, yes, I can get all of the analytics I want out of whatever it is, whatever machine learning AI tool. It could be a Hadoop big data platform for all we know. But if I can't measure it from a KPI, a key performance indicator perspective, and measure cost, I've heard things like that's useless to me. So it's interesting to me that you're embedding it deeper into the platform.
You have to tie the cost in there as well, and show them not only are you helping patients, but you're addressing the cost issue as well.
Yeah, absolutely. Well, Adam, thank you for taking the time today.
You're very welcome.
And to our listeners, thank you for tuning in. If you have comments about today's episode, please check out and follow hashtag CTO Talk on Twitter, or follow me at MP Ferrari. You can learn more about CTO Talk at Healthcare Now Radio or cleardata.com. And I'm Matt Ferrari. Until we speak again, have a wonderful week.